Good afternoon, and welcome to the Health Leaders Revenue Cycle Now online summit. My name is Luke Gale. I am the Revenue Cycle Editor for Health Leaders and will be your moderator for this session. Today's session is titled, Where AI is Making an Impact, sponsored by Waystar. Thank you to our sponsor for making today's program possible, and to you and our audience for participating today. Before we get started, I have a few housekeeping details. Our program will be 60 minutes in length. An on-demand version of the program will be available approximately one day after the completion of the event and can be accessed using the same login link that you used for the live program. To ensure that you can see all the content for the event, please maximize your event window and be sure to adjust your computer volume settings and/or PC speakers for optimal sound quality. Next, you will find a resource list for today's webinar in the upper right of your screen. Here we have listed the webinar slide deck and supplemental resources for you to interact with. At the bottom of your console are multiple widgets you can use. To submit a question, click on the Q&A widget. It may be open already and appear on the left side of your screen. You may submit questions at any time during the presentation. However, please note that it is likely that your question will not be answered until the Q&A portion of the program. Finally, should you experience any technical difficulties during today's program and need assistance, please click on the Help widget, which has a question mark icon and covers common technical issues. At this time, it is my pleasure to introduce our panelists. Bill Arneson, Director of Business Operational Transformation at Moffitt Cancer Center. Keisha Downs, Vice President of Mid-Revenue Cycle at Beth Israel Lahey Health. And Christine Fontaine, Solution Strategist at Waystar. Thank you all for joining me today. And with that, let's get into our discussion. And first, can you please just tell us a little bit about yourselves and your organizations? And Bill, if you want to kick us off.
Yeah, so I'm Bill Arneson, Director of Business Operational Transformation, referred to as Director of Bots because we've done so much automation. I've been at Moffitt nearly 15 years. So Moffitt Cancer Center is the only, NCI designated cancer center in Florida. So we have, a tremendous amount of research and obviously patient volume. We're continuing to expand across Florida. So with that brings a lot of challenges. It's great for business unfortunately, right, there's more and more cancer patients coming into our system. But as the business expands and grows, it's up to us, right, to bend that cost curve so we aren't hiring exponentially with our growth. That is one of the main ways, right, from our point of view, we look at things is how to help the business accelerate without all the costs accelerating as well.
Thanks, Bill. And Keisha, if you'd like to go.
So my name is Keisha Downs. I'm the Vice President of Mid-Revenue Cycle for Beth Israel Lahey Health. Mid-Revenue Cycle, I oversee HB and PB coding, HIM, and CDI. Beth Israel Lahey Health is a 14-hospital system here in Massachusetts, just recently expanded into New Hampshire. And we are the second largest healthcare system in Massachusetts. So we have a combination of academic medical centers, community hospitals, and specialty hospitals.
Thanks, Keisha. And finally, Christine.
Good morning. My name is Christine Fontaine. I'm a solution strategist with Waystar. I've been with Waystar about 8 years. I'm real happy here. We provide, and my role is to talk to our clients about what technology, what automation can do for them, and how we can help them as a partner. Started my career as a revenue cycle director at Memorial Sloan Kettering Cancer Center quite some time ago. So I like to refer to myself as a jaded revenue cycle director. So certainly talking about AI and what it can do. It's not anything I thought we'd be talking about in my career, my lifetime, but really exciting stuff going on there. So looking forward to the conversation today.
Thanks, Christine. And we'll move on to our first question. Where are you seeing AI and automation deliver tangible, consistent results right now for the health systems that you work for and across the revenue cycle? And Keisha, let's start with you.
Yeah, so I think we're seeing, I'm sure everyone's heard of bots being able to call when it comes to authorization and sitting on hold with the insurance company. So we're seeing some technology in that space. When we're thinking about AI and how we're using that within at least the mid-revenue cycle. We're having autonomous coding solutions that are helping code some of these areas that are high volume. We also have AI helping provide suggestions when we're thinking about documentation and how we can optimize that documentation. There's also technology like the clinicians are using. So different AI scribe type technology where we have AI using natural language processing can listen to the collaboration between a patient and their clinician, and that encounter being able to be translated to a template and have optimized documentation. So we're definitely seeing this in a lot of different areas that are helping to reduce time, increase, between clinician happiness and not having to spend those weekends catching up on notes, and then also helping to streamline the way that the work is being done at a high level because the technology is providing support to those teams.
Thanks, Keisha. And Bill, can you tell me about what you're doing at Moffitt?
Sure. So we've been doing automation, robotic process automation for 12 years now. So we have touched pretty much every part of the revenue cycle with your traditional logical automation. So much so that across the board, we have about 500 digital FTEs going around and doing stuff. Excuse me, anywhere from financial clearance, eligibility, policy allocations to denials. Where AI comes in and where all the hype is coming in is right now we have an automation tool or a piece of it that can be smart. But AI is still pieces of the workflows, right? We don't have full-blown agents that can replace people, honestly. But these AI can spawn multiple automation pathways from here. Some of the things we've really focused on internally is something as simple as sharing good Copilot prompts, right? So we have financial clearance staff that are drafting authorization letters. So they build out a template. We're like, okay, with this appointment type, here's what we need from the clinical note to justify it and the wording. So they've shared a prompt and it saves them, even if it saves them 20, 30 minutes per letter, that's still value. So we try to focus on those kind of things that all the peer groups and the people in the front line know right away. And we have denial appeals. That's everyone's big thing. So we've started with medical necessity with a vendor to come in, start hammering those appeals. But not only that, tell us, if the appeal is upheld, where did we fail in the process? So we have an iterative process from what we've learned from AI to, fix the process ongoing and reduce appeals or denials in the future. We are working to implement as Keisha said, the medical coding. We have a medical coding vendor coming in to start with the pathology and radiology coding, some of the more simpler things to do. Simple being relative in this case. And then our big forefront we're pushing into is contracts. So whether it's payer contracts, clinical trial sponsor contracts are a big nightmare. That foray is where we're planning to see over the next year a lot of other advancements as we can get contracts into a text format in a database that can be read. There's a lot of possibilities from there. Those are our main areas of focus right now.
Thanks, Bill. And Christine, what are you working on at Waystar? What are you seeing across the industry with your clients?
Yeah, Keisha and Bill touched on most of the things that we're doing there. And, we've been doing automation and RPA for about 15, 16 years now. And certainly that's made an improvement in the revenue cycle. And we're touching on AI, right? So, we looked at what was everybody's appetite for AI about a year ago, and it really wasn't that great. And we've seen that grown exponentially over the last year or so as to everybody's engaged in it. But, we're using AI in eligibility and coverage detection, right? Where we see most of the denials are happening, most of the errors are happening up front. So we're improving coverage discovery rates by identifying unknown or either secondary insurance or COB alerts. We've been playing in the prior authorization space for some time now, but really what automation is doing now is delivering measurable ROI through real-time authorization submissions and status checks, right? Everybody wants to move to the API strategy, the FHIR APIs that CMS is saying we have to do by 2027. We have found that most payers are not really, or they all have different establishments of what FHIR API looks like. So something we are definitely looking at. Denial prevention and management, we're really seeing that. Identifying high-risk claims before the submission. So being able to actually look at your claim, look at your front-end data. So again, your data lake and the ability to look from front to back is important. And being able to say, hey, you've got an authorization for, CPT code XYZ, but you actually did CPT code ABC. And then being able to stop that, maybe get a retro auth work through that at that point in time, using things like predictive analytics and prioritize denials. So my staff used to, beat denials to death, right? And if there is no value to them and they're working them for, 90 days, 120 days, keeping it on my AR, we want to be able to get the recovery, knowing that not every denial is going to get work, but those that do get work typically get overturned. But, you don't want to work those that there is absolutely no value. Keisha talked about coding and clinical documentation, and I think it's cool to see the word autonomous coding, right? To see things like NLP, right? And computer assisted coding that really get into it. I'm still a little bit, like I said, jaded revenue cycle director here. I don't know compliance wise whether or not a system, same thing with clinical appeals, right? Is an appeal being done autonomously without a staff member engaged really what we should be doing from a compliance perspective, but definitely looking at doing denials, maybe more of the use cases, the high volumes, but the easier ones, and then get into the clinical appeals where you've got to get all that documentation and stuff. So, and then being able to do an AI-enabled digital engagement platform. So really making it easier for the patients because that's what we're here for. So using things like chat box, dynamic payment offers, intelligent scripts, being able to explain their bill to them and personalizing that, really improving self-pay collections and payment plan uptake significantly. So I think the most consistent ROI is emerging where AI augments and not replaces staff. Again, that's where I think it needs to be. Automating repetitive rules-based tasks and surfacing actionable insights allows teams to focus on exceptions and complex cases, driving measurable financial and operational gains. So I think that's where Waystar is going. That's where I see the industry going to that.
Thanks, Christine. And you all have already touched on a lot of this, but our second question is, denial prevention is a major goal for every revenue cycle leader. How are recent trends, particularly advances in AI, changing the approach to denials? What specific uses of technology are decreasing denials now? Have you had any success in this space, Keisha, at Beth Israel?
That's a great question, and I think I love to say that autonomous coding is actually a misnomer. It's not truly autonomous. And when you start asking those real questions and better understanding what autonomous truly means, and when we're thinking about autonomous from the documentation to claim, the percentage that can actually go without any type of exceptions definitely is not 100%. So I think we're on the same page when it comes to being very mindful of compliance. And of course, that compliance can result in denials if we're not, being a good steward in this space when it comes to these type of things. I think when we're thinking about denial prevention and utilizing AI for that, it's trying to be as proactive as possible in every space within that contributes to the claim, to try to be mindful of how we can potentially prevent those denials. So, when you're thinking about that AI scribe being able to capture all the requirements when it comes to the documentation, when we're thinking of a primary care visit, that and collaboration with templates to make sure that we're not missing what's needed during the annual wellness visit or anything like that, that helps prevent those denials. When we're looking at the coding piece, just like what was stated earlier, being able to have technology that can understand what we have in our contracts when it comes to medical necessity, and how do we validate and verify that those that the care that's being provided is aligned with the diagnoses that are being submitted. So having the technology be able to help flag those type of things, to put it in front of a coder to say, hey, this diagnosis is not specified enough. There's more clarity that's needed, or perhaps there's some discussion that needs to happen with the clinician to make sure that the documentation aligns with what the expectations truly are. And then, of course, when we're thinking about not just the documentation and the coding, but also there's technology out there, even on the inpatient side, when it comes to level of care, making sure that, again, that we're utilizing the resources that are required when it's either inpatient or outpatient, or observation. And again, having that technology when we're thinking about how a person can read through, what I tell my staff is, an account that I code on, 8 a.m. on a Monday is going to get a different type of energy from me that we'll get on a Friday at 3 p.m. So having that technology kind of helps stabilize how we're approaching these different things and flagging things appropriately. So I think, again, as nice and clean as we can get it with the use and support from the technology so that the claim can go out as nice as possible, hopefully is going to see a downtrend on what's coming back to us because we aren't meeting the expectations.
Really helpful answer. Thank you, Keisha. And Christine, you mentioned a lot of what you were doing with denial prevention at Waystar and how you are working with your clients. Anything to add to what you had said earlier?
Yeah, and I know from my experience as a revenue cycle leader, we typically manage denials after they occurred. And we were lucky if we got into denial prevention, right? It was always denial management. And I think historically, even today, that's where we are. We're just trying to manage the denials that the insurance companies are just continuing to. I think they're using AI to deny our claims as well. But, we were working through queues, appealing case by case, again, beating denials to death. I think today, AI and automation are enabling basically a first pass right mindset. So it's identifying denial risk before the claims are submitted, dynamically correcting issues upstream, predictive denial analytics. Again, machine learning models trained on historical payer data and EDI patterns, right? So if you're seeing that you're always going to overturn this denial and you're never going to overturn that denial, and we don't want to make it self-fulfilling, right? It's got to be data that is, again, a huge data lake across the industry, across thousands and thousands of providers that can lend that predictive analytics and, reduce those denials moving forward. I think moving into a denial prevention strategy, right? Looking at root cause. And when we talk about things like root cause, we're not talking about, it's denied for eligibility and enforcing a root cause, right? If you don't know the root cause, then you're basically minimizing the capabilities and that data to say, well, if it's denied for eligibility, what's the root cause? Patient access. Well, we don't know that, right? Yes, it's easy to point a finger at patient access and say the reason they got eligibility wrong was they didn't do their job. No, not necessarily. Things like retro or COB alerts and things that are out of network alerts. So we don't necessarily see. And things like authorization, right? So to be able to turn around and say, I got denied for authorization. Well, you didn't do your job. You didn't get off. Well, yeah, we did. But when the patient came in for that radiology exam, the radiologist changed the exam or they ordered another exam that required authorization, getting denied, very difficult to overturn. So I think it's still relatively, it's exciting to see what's going on. And again, that data basically just being a constant learning thing, right? It's a learning system. And I think that Bill talked about that, whereas he's looking at, well, why didn't our appeal work and how do we learn from that? You constantly anticipate payer behavior, identify vulnerabilities before they hit the AR, and then automate that corrective action that can keep revenue flowing as cleanly as possible.
Thanks, Christine. And we'll move on to Bill.
Are we on the next question or the same question?
Same question.
Okay.
Prevention. Sorry. We're having some slide issues here.
No worries. So they both laid out everything extremely well. Excuse me. So ditto to all that. What I will add is one thing that a change we've taken to approaching denial appeals is AI has allowed us to lower our threshold for appeals. There's a cost associated with the time and effort, right, to make any denial appeal, and ours, depending on the complexity and everything, was around $50 for us to work it, get it out the door. Now with AI, specifically starting with medical necessity, that can be as low as $5. So now if we have a $100 claim, before we would just write it off, it's not really worth the time and effort, but now it is. So just by us lowering our threshold for what we are going to appeal, and it's so much faster and we can keep up with the volume. We have had this new AI product in place for not even quite a year yet. It really went live in January, and we've already seen $500,000 that we were able to collect that we would have written off before. So that is another margin we can squeeze, right? These will never prevent every denial, but being able to appeal them properly is kind of the last aspect that hasn't been mentioned yet of where revenue cycle can get back, a little bit of those things that should have been done properly. But as we mentioned, all the payers have tons of AI systems denying as much as they can, and they're all based on their probability and stats that it will hold up. So we're just trying to move that needle just a little bit, back in our favor.
Thanks, Bill. And we'll move on to the next question. As AI automates more routine tasks, how does that change the day-to-day work and the required skill sets for your revenue cycle teams? And Christine, let's start with you this time. How are you kind of helping your clients to manage this?
Yeah, and I think it's an important thing to note, when I talked at a conference on AI, and I think everything is about AI anymore. AI is not replacing revenue cycle teams. It's not going to happen, right? When people go in and we're going to get rid of 100 people at FTEs, it's redefining their focus. As automation and AI handles routine-based work, so things like eligibility checks, status inquiries, data validation, maybe first pass edits, right? Human expertise is shifting towards exception management, doing analytics, strategic problem solving. I think that the workforce is evolving from doers, right? We're doing data validation and data entry to decision makers, right? So we're moving from data entry to data validation. So we're working from work queues to intelligent workflow. And I think that's the different thing, right? So it's intelligent automation, right? So where AI prioritizes work by financial impact, payer behavior, and then likelihood of recovery, right? Allowing your teams to focus where it matters. So I think that's the important thing to look at. It's not reducing the importance of human talent, it's elevating it. I think the most successful organizations are reskilling teams to manage exceptions, interpret insights, and then collaborate with technology, turning automation into a true performance multiplier across the revenue cycle. So it's not replacing people. We're still all going to be here. I think revenue cycle and care it's a people thing, It's not technology. It's just going to help us do it a little bit better.
Thanks, Christine. And Keisha, do you agree with that? How are you reskilling or upskilling the folks at Beth Israel?
Yeah, I echo what Christine said. When we're thinking about the concept of human-centered AI, this is not just how the technology can come in and take over all the tasks. It's how can the technology support our teams to do the work that needs to be done. And, just like Christine stated, it's all about upskilling our teams. So we're not doing those monotonous day-to-day type, those low-hanging fruit type tasks. We can have the technology help support that. And the things that do need critical thinking, that needs that support, that needs that strategic, review when we're thinking about what needs to be done, that's what's coming to our teams. And that's what they're using to, drive their day-to-day. So I know I hear all the time that, folks are super concerned with, AI coming in and not wanting to engage with the software because they're concerned that they're training something to take their jobs and those type of things. I think AI is changing how we do our work. I now have a team that is specifically working with an AI software that we've implemented. So, that was not a position that was, available 2 years ago or 3 years ago. But now I'm very appreciative that I have that group that knows how to interact with that software and be able to, have some really tangible outcomes from working with it.
Thank you, Keisha. And Bill, how are you and your staff at Moffitt handling this?
Yeah, so this is our revenue cycle culture. We've automated so much for so long that you have to have this ingrained from top to bottom of embracing automation or improving whatever workflow there is, and then what's next, right? Because you're taking away someone's time that they're spending doing one thing, and there's endless amounts of work to do. So what are they going to do next? That's just the continuous cycle that we live in. Some great examples we've done, and this can be very beneficial for staff as we've encouraged them to do it. We had financial clearance people that were doing, eligibility and some things that we're able to automate. Well, they were able to flip over to now work denials for financial clearance, those auth denials and stuff like that, more complex work, also a higher graded position. So we're able to automate stuff, move them up, and still bring more value to the company. So I think just leveraging people plus technology helps both, and it helps everyone across the board. That is what we've been pushing. And honestly, just keep hammering the message, especially with AI, learn to prompt, right? Play with it. Do your prompt engineering. Figure it out, right? We have Copilot internally for all of our staff. It's a great tool, but you have to learn how to use the tool. So we just encourage that, and we encourage sharing, just being open and transparent about, yes, AI is here. As we've all said, it's not going to replace any person. It is to amplify the people that do embrace AI. So that has been our main message. We've been automating for years, and we still have a ton of staff. This is no different going forward.
Thanks, Bill. I want to go off script for just 1 second. You've all mentioned a few things that I think makes me want to ask this question. Bill had mentioned that we don't have full-blown agents yet. Keisha mentioned that we don't have full-blown autonomous coding yet. And I just want to ask about the pace of change that is occurring in the AI space. Christine mentioned, that no one was really kind of as interested as they are a year ago as they are today. So I just want to ask, as we think about staff, or as we think about the capabilities of AI moving forward, how are you kind of preparing yourselves and your health systems for that sort of pace of change that has been occurring? Any takers there?
I can jump on that. So I think the pace of change in the news is vastly different than the pace of change in healthcare, right? So businesses adopting AI technology and actually implementing it will be a severe lag compared to what you're able to do personally at home. There's a lot of stuff I can do right myself with my own workflows outside of work that is not going to fly at work. It's not compliant. There's HIPAA regulations, all of that. I think the main catalyst will be the big software companies, Epic, Waystar being in the mix there, of what are they going to help drive and make easy to implement, because not every place is going to have the people or resources to implement AI. And then coming right behind that, who are the leaders in your organization that are going to drive that change? Because it is, what are you going to do? How are you going to govern an AI agent? Who is responsible for the actions of that agent? How do you audit them? There's so many unanswered questions that will be figured out, but it's going to take time. And as we've already touched on, healthcare is still human interaction. So those soft skills are never going to be learned by a computer. The face-to-face interaction is never going to be learned by a bot. So as more and more of the mundane digital work goes away, I think that is where people are going to thrive, right? Is being able to have those personal skills to leverage the system and move forward that way. So that is what we've been pushing. Like everyone said, it's not a replacement for people. It's a replacement for the mundane work that people shouldn't have to do.
Yeah, and I agree with Bill in that sense, in that, there's a lot of razzle dazzle in the industry, right? There's a lot of hype, right? And there's a lot of vendors that are going out there and promising significant things. And I think we have to be careful about that. Like I said, jaded revenue cycle director here, and I never thought we'd even be talking about AI in revenue cycle. It had to be a human. I'm starting to think differently, but I think that there are a lot of vendors out there that are promising things like 100% automation, right? They often claim it can fully automate your revenue cycle, eliminating the need for humans. I don't think that's ever going to happen. I think they're promising plug and play simplicity, right? You're just going to be able to instantly deploy it, right? And it does not, right? They're only as effective as the data they access and the infrastructure they're built upon. So you have to have a lot of data to be able to have AI actually work. The other thing that they're doing is immediate ROI, right? We're immediately, and I think we have a question about ROI there, but it's like, you're going to make all this money and you're going to save all this staff and stuff. And it's not a fast track to financial improvement. So I think we have to be careful about, again, the razzle dazzle and the marketing dollars that are going into, we're going to do all this AI stuff and we're going to make, completely autonomous clinical appeals. And I just don't know if that's really where the industry is today. So I think we have to be cautious about what we expect, and then accept what we can do and continue to work towards moving forward.
I think I need to start calling Christine just a jaded revenue cycle director.
That's it.
Thank you both for the answers. Keisha, anything to add to that?
No, we're in the space where we need to be informed consumers, because there's so many sparkly, razzly, dazzly type of technology out there. And there's a lot of promises being made. And when you're not an informed consumer, and that informed consumer being the decision makers who are deciding what type of technology we should be bringing into our institutions, then you're in a position where you almost have to rely on the information and what's being quote unquote sold to you from these vendors. So I think platforms like this is so important, because we have to better understand and kind of reset expectations, so that we can, when I'm going to my C-suite and I say, I've heard that day one ROI, Christine. So, I'm maybe I'm becoming a jaded revenue cycle leader as well, because I've been there and had to speak to that. So I'm just grateful for these type of platforms so we can have these type of discussions.
Thanks, everyone. Great answers. Moving on. When building business cases for new AI investments, what are the most important KPIs, or even just more broadly, what do revenue cycle leaders need to do to prove clear ROI or to sell these platforms to senior leadership at their health systems. And Bill, let's start with you.
Yeah, so the most obvious example is hard dollars, right? As the example I brought up earlier with we're able to do more denial appeals for cheaper. So we actually collected more dollars. That's best case scenario because that's a measurable thing that is not a feeling metric. So that is perfect. Other things are all the big normal revenue cycle metrics. Can you move your cost to collect at all? Can you change your AR days or your collection days? Can you move those buckets at all? Can you slide things from, under 90 days? One of the big things for us is the days to start a clinical trial, right? There's a bunch of administrative work before you can actually launch a clinical trial. And the more we can shrink that time frame, the better it is clinically. So those are some of the big things that try to, what are the CFO's metrics that she looks at every day? And can I move those needles? That's the easiest and best way I know I'll make an impact.
Thanks, Bill. And how are you doing that at Beth Israel, Keisha?
So it's funny, I was just having this conversation yesterday with a few leaders. I think that we're going to be moving to the point where we're going to have KPIs, not just for our human staff, but also for our technological staff. And how are we keeping and maintaining accountability on both sides? So, I'll speak to the autonomous coding piece. There's no solution out there. And if there is, I would love to, I challenge you, but there's no solution out there that can do truly 100% autonomous coding. And when we're thinking about autonomous coding across all areas within the revenue cycle, there's probably one area that they do really well, maybe a handful of areas that they do really well. And even with that, it's not 100%. So I think we're able to, when we're thinking about those KPIs and when it comes to autonomous coding, like, okay, well, what is your autonomous coding expectation? What percentage are you saying that you feel like can be done truly from documentation to claim without a person intervening? What are the quality pieces around that? And then, to help maintain that accountability, we'll be able to see that on the ROI. Bill, like you said, AR days, getting these things out quicker. But I think having that within the contracting is important as well to help make sure that they understand that there's an expectation for quality and that automation rate.
Thanks, Keisha. And Christine, anything to add?
Yeah, I think AI's value must be measurable, right? So you actually have to tie your efficiency gains directly to financial outcomes. So, and focusing on metrics that clearly demonstrate either a lift in revenue integrity, collection rates, staff productivity, cash flow. So looking at things like denial prevention and reduction. So the KPIs that, we're focusing on are the initial denial rate. How do we prevent that denial happening in the first place? Avoidable denial rate. The denial write-offs as a percentage of net revenue, right? And it should reduce denials and prevent recurring issues. Looking at your clean claim rate, so the percentage of claims paid on first class, claims requiring resubmissions, average days to payments, right? So you want those AI-driven edits and eligibility intelligence directly improve that first pass yield rate and have a better clean claim rate. You don't want your staff touching those. Staff productivity and capacity gains, accounts worked per FTE, touches per claim. The cost to collect, as Bill mentioned, is certainly something that we want to focus on. Revenue recovery and underpayments detection. So identified underpayments. I know that's a world that everybody's chasing after that is very, very difficult to get. Recovered variance dollars and net revenue lift. So, and then days in AR, lags from discharge to billing, and, authorization turnaround time. You want to streamline those upstream steps, shrinking time to payment and improving that cash productivity. So again, you want to connect the operational efficiency to financial performance. And it's not proven just in speed, but in sustained improvements in denial rates, cash flow, and again, workforce leverage.
Thanks, everyone. Great answers. This has been a great conversation. I do want to remind the audience that we have about 20 minutes left, and we'd love to get some questions for you. And there's a widget somewhere on your screen where you can ask those questions. We'd love to hear them. For now, we will move on to our next question, which is, what is an unexpected challenge, or can you give a specific example of an unexpected challenge or roadblock that you encountered when implementing a new AI or automation platform? Keisha, do you want to start?
Yeah, I think one of the roadblocks that I encountered is kind of what Bill touched on earlier. You know, having this great technology, but not having the IT bandwidth to be able to implement it, you know, the way that we need it to be implemented can definitely cause some delays and slowdowns when it comes to being able to implement something timely. So, you know, making sure that you understand all the key players, making sure that you're very much so in tune with your IT leaders, so that you can be able to justify adding this to yet another project list that they probably have going on. So being respectful of that bandwidth is really important. So that was one of the challenges that that I encountered. Another unexpected challenge, and I think it was one of those, you know, being a novice to implementing technology like this, was, you know, putting a lot of trust in what the expectations would be. So, you know, implementing too broadly to begin with, really should have started smaller with some of the initiatives and then went a little bit bigger. So I wouldn't call it necessarily a roadblock, but one of the challenges that resulted from that was you know, making sure that my teams felt comfortable using the technology. There was a lot of mistrust in the technology, but it's probably because it was implemented in places that weren't the best place to be implemented. So definitely a novice mistake, and something that now with future implementations, we know we have more of a roadmap and more of a plan on how to do this in a more strategic way, so that we can see the benefits and then be able to expand it and see a broader ROI and buy-in from my team members and just functionality within the tool.
Thanks, Keisha. And Bill, Keisha stole your earlier answer about you know, having the staff to work through these problems. But any other challenges that you're running into unexpectedly?
Yeah, well, not unexpectedly. I think for any of these initiatives, it always comes down to the culture. Does the organization have the will and flexibility to do it or not? I know it's a small bullet to throw out there, but like Keisha brought up, are you going to implement AI? If so, an executive will say, I want this AI thing. Are you going to invest the IT dollars? Are you going to drive this change? Are you going to support the people from the top down to work through all the cultural fears of staff? All of these things are part of AI. The technology piece is completely separate from the actual implementation piece, right? Technically, a lot of these things can be done, but organizationally could be a vastly different story. I think that's with automation or AI, that's the number one factor of, is it going to be successful or not? Does your culture and your business have the will to do it or not? Either it's important and it's a priority, or it is not. It can't be in the middle, though.
Thanks, Bill. And do you have anything to add, Christine?
I think Bill and Keisha wrapped it up pretty nicely. I think we're focused on change management and workflow alignment. So automating tasks that staff have performed for years can absolutely create friction. Teams may distrust AI recommendations. Well, I wouldn't do it that way, but AI says we should do it that way. Or they struggle to adapt to the existing workflows that AI is recommending, or they work around it, right? They're not supposed to touch this account for the AI schedule or whatever, or their recommendations, but they touch it anyway. So, I mean, just working around it when you implement, whether it's a great technology system or a workflow system. So that success is going to depend on as much as on training, engagement with your team, clear technology and communication on what the technology itself is going to do. And again, understanding that we're not going to replace you. I think that's what the staff is afraid of. I constantly do this. If you get a bot to do it, what's my job going to be? And again, upskilling them and recognizing you're not going to replace them. You're not reducing FTEs. You're making them more working top of license, top of mind. So I think that's a lesson that we've all learned, and AI is just another component of it.
I think I'll just add as well, I thought of a challenge that occurred that I hadn't anticipated. I know we speak a lot about AI and technology kind of having concerns from the staff. I saw the opposite in one of my implementations where the team almost had what I would call an analysis paralysis. So the prompts that were coming from the AI solution had them questioning their own skill set and if they were correct. And, having to remind them that, this is still a tool. This is technology that's here to support you, is giving you suggestions. But at the end of the day, their decision and their critical thinking is what's going to be the last decision. Mm-hmm. So that was one of the things that I was kind of surprised to encounter, how some of the team members were just questioning themselves so much based off of the prompts that were coming from the technology.
Thanks again, everyone. Great answers. And we're moving on to our final planned question. For health systems just beginning their AI journeys, what is the most important first step to take? And Christine, we'll start with you.
I think health systems need to start with the focus, not with technology. The most critical first step is identify a clearly defined, measurable problem within the revenue cycle where automation or intelligence can deliver rapid, visible impact. So things simply like claims monitoring, claims statusing. Your staff should not be going out there and checking the website and determining that the claim is going to get paid. Using automation and AI to enable that is what we need to do. So you start small, and I think Keisha mentioned it. Maybe we started a little bit too broadly. So you start small and scale with evidence. So choose a high impact, low complexity use case. So it might be in eligibility and coverage discovery. It might be in prior auth status and automation. It might be in predictive denial prevention. You want to have something that has a structured data, repeatable process, and somewhat of a fast ROI, and then embrace that. So, but going, pie in the sky really high and saying we're going to automate this when you really need a human intervention and decision-making engaged, I think that's where we're getting a little bit out of the scope of what AI can do for a health system.
Thanks, Christine. Bill, any advice for health systems just starting their AI journey?
Yeah, I 100% with Christine. Start small. As I said, with automation or AI, just start pushing that snowball down the hill, right? And it can gain speed down the road. I'm going to go back to culture, the change culture. Have a good business owner of your first process, management all the way down to the frontline staff. Everything has to be transparent. They all have to be on the same page, because there are real fears out there, right? Of AI is going to take our job. So that is the number one thing. Get everyone on the same page. Everyone's comfortable, and then you can adapt, and then you'll have ideas being driven from the ground up of what are the best use cases to come next. So I think, culture is the number one thing I would encourage everyone to nail first.
Thanks, Bill. And Keisha, do you want to close this out?
Yeah, Bill took my answer. So I was going to say, you need to understand the appetite for technology within your health system, because if you're very energetic and excited for this technology, but it's not there in the other places in the health system, then you can have the best use case, you can have the best technology, but if you don't have the right folks who are going to be committed to driving this home, then it's going to fall short. And then I think, after you start understanding the appetite and the understanding, setting realistic expectations. So this is to help support and optimize and streamline and decrease waste. This is not going to save you 50 FTEs. And I think, having those real conversations in the beginning is going to help contribute to realistic outcomes and expectations of those outcomes.
Thanks, Keisha. Thanks, everyone. This has been a great discussion, and we are ready to move on to the Q&A portion of the program. If there are any other questions, please submit them now. We do have a couple here, and one is when you're defining the metrics to determine the success of your AI platforms, how are you establishing the baselines, and then how are you actually measuring those metrics? Anyone want to take that one?
Data. You're going to have to go back into your data to understand your baselines. So that's a lift in itself to be able to get the data, the accurate data, to be able to reflect what your true baselines are, and then where the efficiency should be coming in to help raise above those baselines. So that would be my first suggestion, is getting your baseline data.
Yeah, and I think you need to set clear KPIs, right? So what are you measuring? Is it denial reductions? Is it the clean claim rate? I mean, those are all KPIs that the baseline should be very easy to measure. I've seen certainly people measure them differently, but I think standardly the KPIs in the industry are set. Is it staff time saved? Are they working more denials? Did they do 50 denials a day last week, but with AI, they're doing 80? What is the overturn rate? Are they using Gen AI enabled appeal letters, right? And is that actually increasing the overturn rate for the denials? So, and then align them with your organizational goals. So I think really defining the success metrics from the start, and then making sure that how you're measuring them are consistent so that you can see that ROI.
Thanks, Christine. Bill, do you have anything to add?
Very similar to everyone else. I'm assuming everyone already has metrics, right? For each department they're measuring. That's the easiest place to start, because you'll see them, right? If they change in 3 months after you start doing something, you will see the difference. It's hard to predict how much AI will impact a metric until you actually see it, right? Same with automation. Like, we will project, hey, this is going to increase this metric by 10%, but until you actually see it, that's just a guess, right? So I would say, have those consistent metrics, but keep an eye on them, because some of these AI things, unlike RPA automation, you can't track exactly and report on what it's doing. With automation, it's easy. Hey, the bot went in and added this, changed the insurance. I can report on that. Not so with AI. It's more of a time and overall metrics kind of thing in most cases. But yeah, so it's, what are your important metrics today, and how do they move?
Thanks, Bill. Thanks, everyone. One more question from the audience, and I think you've all touched on this a little bit, but if you want to mention anything more, how are you working through trust in AI, either with your staff or with your clinicians or with patients even? How is that working for you? And anyone can just weigh in here.
Yeah, for our trust, we have a very rigorous internal, compliance and audit team. We have a audit team just for the revenue cycle that does a monthly audit. So that builds trust into the system, and we purposely have them audit whatever AI is doing all the time. We have them audit what our bots are doing all the time as well. So I think putting them through the same rigors as you would a person is very important. Those manual checks, not just assume, oh, well, the computer is doing what it's supposed to do no matter what. You have to have the continuous auditing and monitoring. I think that on the back end is wonderful, but the people using it on the front end, have them be part of the data and process validation to set up the AI solution, right? So the person on the front line is the one validating the answers are correct. And then they can be either the human in the loop later if needed, or you can audit after that. So I think having the expertise, give it the okay at the start, and then auditors, being very diligent about monitoring forever is kind of our two-pronged approach for that.
Thanks, Bill. Christine or Keisha, anything to add? Go ahead.
I would say with my teams, I mean, a lot of times trust comes from, helping them understand what our goals are from it. So some of that mistrust may come from, like Bill stated, fear of impact to their role. So being very clear and transparent on the technology itself, how it works, what the goals are for it. And then I think with the actual tool itself, depending on what type of technology and what type of AI it is, being able to have transparency and kind of what's driving the decision making of the technology. I know, like for the AI scribes, being able to have the transcript available to see what conversation happened has been proven successful when the clinician feels like something was said that wasn't said. We're able to pull the transcript to say, well, this is the dialogue that happened. For some of the clinical things, when we're thinking about documentation and query optimization, we have the AI is able to tell us where it's pulling that information from. So not so much of a black box, and being able to make that information discoverable also helps contribute to the trust in the technology.
Thanks, Keisha.
Yeah. And I think, I think we've mentioned it multiple times. Change management within your team is as critical, if not more important, as the technology itself. Engaging your staff early, communicating the why of why you're bringing in AI and what it's going to mean to them. Providing training around the AI supported workflows. And that's going to accelerate adoption. They're not going to work around it. It's going to accelerate trust, right? They're going to trust that the technology is doing what it should do, and then they'll work with it. But, you have to engage them and again, keep the expectation of what the technology is going to do to a simple thing, right? And don't make it's going to do all of this stuff when it really in reality can't.
Thanks, everyone. That brings us right about to the hour. I just want to thank you all again, all of our panelists, for an excellent discussion, and to our sponsor, Waystar, for making this session possible. And thank you to everyone in the audience for participating. We hope you enjoyed this session and look forward to seeing you again during future Health Leaders webinars. Thanks, everyone.
Thank you all.